One piece of what successful aging will look like is that individuals can access the care that they need regardless of who they are, where they live, or their ability to pay. Right now, Medicare has structural incentives that ensure that only a small proportion of people with chronic conditions can receive the care that they need. For example, over 40% of people with Parkinson's disease who are Medicare beneficiaries don't see a neurologist for their condition. And those individuals are more likely to fracture their hip, more likely to be placed in a skilled nursing facility, and more likely to die. And really a large reason this is because Medicare incents care to be provided in institutions and disincents care that to be provided in patients' home or patient-centered care. Right now, Medicare pays $150 for a patient to go to a major academic medical center to get a follow-up visit for Parkinson's disease or Alzheimer's disease. Pays $80 for that same visit in a community clinic that's closer to the patient, and pays $0 for a patient to be able to access the exact same care in their home remotely. We think the incentive should be changed completely in the opposite direction, so that there's more incentive to deliver patient-centered care where patients are, and less incentive to receive care in high-cost institutions. Physicians should be developing new care models that address the needs of patients, and they're readily in a great position to recognize there's current shortcomings. The more important question is, what should patients and individuals who are aging be doing, and their caregivers? There's over 50 million Medicare beneficiaries, and there's over 40 million caregivers of adults. Those individuals should be demanding change, demanding that Medicare provides access to care that they need. Until the public sector, recognizes the shortcomings in Medicare coverage for chronic conditions, the private sector is going to provide solutions, but those solutions are going to be targeted at people with means. So we heard here at the d.health summit that 50% of older Americans have annual income of less than $26,000. They're not going to be able to take advantage of solutions that are going to be generated by the private sector that are being focused on self-pay. These individuals have been paying into Medicare for 50 years, implicit with a social contract that when they get older, they would be able to access the care that they need. And right now, the only way they can access the care that they need is to do it on the terms of an institution instead of on their own terms. So my name is Dorsey. I'm a neurologist at the University of Rochester.